Welcome to Body Talks Health. Today we visualize the biology of migraines and the specific medications designed to rescue you. A migraine is far more than just a headache. It is a complex neurological event involving intense throbbing and severe sensitivity. To understand how rescue medications work, we must first look deep inside the brain to see exactly what triggers the pain. During an attack, your nervous system becomes overexcited, launching a cascade of chemical reactions that result in debilitating physical symptoms. This overexcitement causes the release of a specific protein called CGRP, or calcitonin gene-related peptide, from the nerve endings. When CGRP is released, it forces blood vessels in the brain to widen significantly, a process known medically as vasodilation. This sudden expansion stretches the nerves wrapping around the vessels, sending sharp pain signals directly to your brain's processing centers. Furthermore, CGRP triggers inflammation in the area, creating a hostile environment that amplifies the sensation of pain and discomfort. This process sensitizes the trigeminal nerve, which is the primary pathway responsible for transmitting pain sensations from the head and face. The result is a sensory storm, where normal inputs like light and sound become unbearable, requiring immediate medical intervention to stop. Nature has its own defense mechanism called serotonin, a neurotransmitter that plays a crucial role in regulating pain and mood. Serotonin acts to inhibit the production of CGRP and constricts the swollen blood vessels, effectively reducing the source of pain. However, during a severe migraine attack, your natural serotonin levels may drop, making it impossible for the body to cope alone. This is where rescue medications come in. They are designed to intervene in this biological process and stop the attack. The first major group is triptans. These drugs are chemically designed to mimic the action of your natural serotonin. By binding to specific serotonin receptors, triptans signal the nerves to stop releasing the pain-causing peptide known as CGRP. Simultaneously, triptans cause the dilated blood vessels in the brain to constrict, reversing the swelling that contributes to the headache. However, because triptans constrict blood vessels throughout the entire body, they may not be suitable for everyone, especially heart patients. People with a history of heart disease or stroke must use triptans with extreme caution due to this vasoconstriction effect. For those who cannot take triptans, science has developed a newer class of medications known as gepants to target pain. Gepants work differently. Instead of mimicking serotonin, they directly block the CGRP receptors, preventing the pain peptide from attaching. By occupying these receptors, gepants stop the pain signal transmission without causing any constriction of the blood vessels. This lack of vasoconstriction makes gepants a much safer option for patients who have underlying cardiovascular conditions or risks. Another option is the ditans class, such as lasmiditan. These drugs target specific serotonin receptors located directly on the nerves. Ditans are highly selective. They calm the overactive nerves without affecting the blood vessels, avoiding heart-related side effects. However, because they affect the central nervous system, ditans can cause significant dizziness and drowsiness, so driving is prohibited. Before modern drugs, we relied on ergots, like DHE. These are powerful medications that have been used for many decades. Ergots interact with serotonin receptors much like triptans, but their effects last significantly longer, providing extended relief from pain. The downside is that ergots are poorly absorbed orally, often requiring injections or nasal sprays to be effective for patients. Like triptans, ergots cause blood vessel constriction, so they share similar risks for people with heart disease or high blood pressure. For mild to moderate attacks, we often turn to NSAIDs. These are common anti-inflammatory drugs, available without a prescription. NSAIDs work by blocking specific enzymes called COX, which are responsible for producing prostaglandins that cause inflammation and swelling. By stopping the production of these inflammatory chemicals, NSAIDs reduce the swelling and pain associated with the migraine attack. While all these medications can be lifesavers, there is a critical danger regarding how often you use them. Using rescue medications too frequently can lead to a condition known as medication overuse headache, or a rebound headache. If you take these drugs too often, your brain becomes dependent, and the headaches return with greater intensity as the medicine wears off. Medical guidelines generally recommend limiting the use of rescue medications to fewer than 9 to 14 days per month. If you find yourself needing rescue medication more often than this, it is crucial to speak with your healthcare provider. Your doctor may suggest preventive medications, which are taken daily to reduce the frequency and severity of your attacks. The goal of migraine treatment is not just to stop the pain, but to restore your quality of life and freedom. Understanding the biology of CGRP and serotonin empowers you to make informed decisions about which treatment is right for you. Remember, every patient is unique. What works for one person might not be the best solution for your specific biology. Never attempt to manage chronic migraines alone. Professional guidance is key to finding a safe and effective management plan. With the right combination of rescue medications and lifestyle changes, you can take back control from the pain. Migraines are a biological challenge, but modern science has provided us with powerful tools to fight back effectively. We hope this visual guide has helped clarify how these different rescue medications interact with your body and brain. From triptans to gepants, understanding your options is the first step toward better health and effective pain management. Science is constantly advancing, bringing new hope and better treatments for millions of migraine sufferers around the world. If you found this video helpful, please like and share it with someone who might benefit from this information. Don't forget to subscribe to Body Talks Health for more detailed medical animations and deep dives into human biology. Stay tuned for our upcoming content where we will explore preventive strategies to stop migraines before they even start. Thank you for trusting us with your time today. Knowledge is your best defense against pain and illness. Please remember that this video is for educational purposes only and does not replace professional medical advice or diagnosis. Always listen to your body and consult with a qualified healthcare professional regarding any medical condition or treatment plan. Your health is a journey, and we are here to provide the visual maps you need to navigate it. We appreciate your support and engagement. Together, we can build a community that understands and values human health. Stay curious, stay informed, and prioritize your well-being every single day. Your body will thank you for it. This content was meticulously researched and animated to bring you the most accurate representation of migraine pharmacology possible. Check the description below for links to more resources and references used in the making of this video. Thank you for watching this deep dive. Subscribe to Body Talks Health for more medical insights. Take care.